The story of fighting cancer has long started with fear, the tense wait for a scan, the loud hum of an MRI, and the hope it was caught early enough. But what if the story could start in the quiet of your own home? What if we could find the villain not when it's a tumor on a screen, but when it's just a whisper in our system? A team from MIT and Microsoft is using a powerful AI to design a molecular alarm for cancer that could one day work from a simple urine sample. This is a glimpse at the new front line in the war on cancer, powered by artificial intelligence. The molecular wall. To understand this breakthrough, you have to know the problem scientists faced. Early on, cancer cells overproduce specific enzymes called proteases. Think of them as molecular scissors. Cancer uses these scissors to cut through tissue and spread. The brilliant idea was to detect the activity of these cancer scissors. The plan involved sending in molecular tripwires, called peptides, that only cancer scissors could cut. The severed pieces would then show up in urine as an alarm bell. But this hit a mathematical wall. A peptide is a chain made of 20 different amino acid beads. A short chain has over 10 trillion possible combinations. Finding the one perfect peptide was impossible with human trial and error. Worse, the wrong peptide could be snipped by a healthy enzyme, creating a terrifying false positive and making the test unreliable. The AI solution, CLEAVENET. This is where the story gets interesting. Researchers from MIT and Microsoft built an AI named CLEAVENET. They trained it on tens of thousands of interactions between peptides and proteases, making it fluent in the language of proteins. CLEAVENET uses a two-part system, a generator that writes entirely new peptide sequences, and a predictor that scores how well each one will work. Most importantly, scientists can give the AI specific orders, generate a peptide that is cut only by a specific cancer enzyme and is completely ignored by its healthy relatives. This replaced random guesswork with targeted AI-guided design. The staggering results. The team aimed CLEAVENET at a key cancer enzyme called MMP13, which helps tumors metastasize and spread. They challenged the AI to design peptides just for it, then tested the results in the lab, and the outcome was staggering. In one key test, every single one of the AI-designed peptides was successfully cut by MMP13, a 100% success rate, compared to about 12.5% using older methods. CLEAVENET even designed peptides that were cleaved more efficiently than the natural ones it was trained on. And then came the ultimate test, selectivity. The AI produced peptides that were uniquely cleaved by MMP13, completely ignoring 11 of its closest enzyme relatives. This was the blueprint for a sensor you can trust. The future in your bathroom. So what does this lab result mean for us? This technology is the engine for a potential non-invasive, at-home urine test. The vision is this. A patient would inhale or ingest nanoparticles coated with these AI-designed tripwires. If the particles encounter a microscopic tumor, its molecular scissors snip the peptides off. These tiny severed fragments are then filtered by the kidneys into the urine. The final step would be a simple paper strip test, similar to a pregnancy test, that changes color to give an ultra-early warning. In fact, this research is part of a project funded by ARPA-8HA, America's Advanced Health Research Agency, to create an at-home kit that could one day screen for many cancers. Conclusion. We must be clear that this is still early-stage research and human clinical trials are a long road ahead. But the speed and precision that AI brings to this process is revolutionary. The team even made their CLEAVENET model available to the entire research community to accelerate discovery. For decades, our fight against cancer has been reactive. This breakthrough represents a shift to offense, building an intelligent surveillance network inside our own bodies. We are entering a future filled with a lot more hope and a lot less fear. If you found this helpful, like the video, subscribe for more learning science, and hit the bell. Thanks for watching.